Howdy folks, it's Kelby out there with Medicare Hub. Today, let's dive into understanding the Medicare appeals process and what to do if your claim is denied. Let's dive in. Hey, have you ever opened a letter from Medicare or your Medicare Advantage plan only to find out that a claim has been denied? It can feel frustrating and confusing, but here's the good news. You have the right to appeal. So why are Medicare claims denied? Medicare claims can be denied for a variety of reasons, but one common issue is that the service is deemed not medically necessary. For example, diagnostic test ordered without detailed documentation from your doctor may get flagged. Another common reason is just incorrect billing codes. If your provider uses an outdated or inaccurate code, Medicare might deny the claim. Lastly, some services such as dental, vision, and alternative treatments are not covered by original Medicare. So Medicare Advantage plans also have additional rules like prior authorization requirements, which can lead to denials if not followed. So example, let's talk about Barbara. She received an MRI for her back pain, but Medicare denied her claim, saying the test wasn't medically necessary. After reviewing her Medicare summary notice, Barbara discovered her doctor hadn't provided enough documentation to support the claim. You know, often we hear when you're asked something that you don't really have clarification on, it's the whole deny, never admit to guilt when you don't really know the details. And finding the details out sometimes in a claim issue is calling and asking questions, collecting the information, and then realizing, just like I gave this example, that she had the documentation to support the claim, and then she was able to appeal and get that covered. Make sure you always collect your EOBs, your evidence of benefits, and then also your invoice or billing, what's been done by the doctor, and line those up. For some of us, we're more administratively strong. Some of us are not. Maybe you have a family member, or maybe one of the spouses is kind of like the bill payer of the home, and the other person is the person that always does all the calls. Kind of figure out your mojo in your home, or if you have a family member, sometimes it's a child or a grandchild that's very sharp with just administrative bookkeeping skills. Let them help look over things, explain to them the situation. And guys, you can always call us. We can always provide you the steps that you need in case you're having a situation where you don't understand how to appeal a process or the process of appealing a bill correctly. So the 5 levels of Medicare appeals process. So redetermination is the first one. The first step in the appeals process is called redetermination. For original Medicare, you have 120 days from the date you received your Medicare summary notice to request this review. Use form CMS 227. Include any supporting documents from your doctor like medical records or test results. Medicare contractors typically respond within 60 days. So Medicare Advantage, if you're on a Medicare Advantage plan, your first step is to file an appeal directly with your plan. Standard requests must be responded to within 30 days, but for urgent or expedited appeals, the plan must respond within 72 hours. Hey guys, if you're like me, I don't like to wait 30 days for anything. Hard enough for my birthday when it's coming up, or an anniversary, or a big event, but much less with a bill. I would encourage you, when you call in, always ask for an expedited appeal process. They have to process that within 72 hours for your Medicare Advantage plan, and just say it's urgent because you're having a procedure coming up and you need to be able to expedite the appeal process, and they have to get that done in 72 hours, and that shortens the window of time. And if you have any trouble with that, again, you can always reach out to your agency that you work with. If you don't have one, you can reach out to our office. We can give you some guidance on that as well. All right, so level 2, reconsideration. If level 1 doesn't resolve your issue, you can request a reconsideration by a qualified independent contractor, or QIC. For original Medicare, you have 180 days to file this request after you receive the redetermination notice. Medicare Advantage plans may have slightly shorter timelines, so check your plan's guidelines for your Medicare Advantage plan. Now, level 3, if your claim is still denied, you can escalate to level 3, which involves a hearing before an administrative law judge. Level 4 involves the Medicare Appeal Council, and level 5 is a judicial review in court. Hey guys, I just explained earlier about deny. I would also say appeal. If you have something turned down, continue to appeal the process. For Medicare Advantage carriers, every time you appeal, it gets closer to what I call Medicare's desk, and the closer to the desk it gets to Medicare, These plans are rated on star ratings, and one of those star ratings is built around the customer service experience that you are experiencing with them, expediting and doing things when it comes to appeals, claims, and all the different matrix that they're measured on. And if you continue to appeal, the closer it gets to Medicare's desk means that they are going to get dinged on that situation, and typically they will step in and then reconcile that issue. Now, granted, if you're requesting for something to be covered that's not eligible to be covered under Medicare Part A and Part B, and you're outside of the boundaries of Medicare altogether, obviously the health plan cannot do that. But if you're within the boundary and you're not getting satisfied customer service, just continue to appeal, and it gets closer and closer to Medicare's desk. And ultimately, I've never had anyone in 17 years ever have to go before a federal judge to resolve an appeal. They're going to resolve that early, but you just use the word appeal. I want to appeal this process. Hey, this is the second time I've had to call in here. I'm appealing it again. Keep notes on what you've said and how many times. And again, the closer it gets to Medicare's desk, typically they're going to resolve that, especially with Medicare Advantage plans, HMOs, PPOs, POS, or whatever you have for a Medicare Advantage plan. The process is the same. So let's talk about the challenges seniors often face during the appeals process. One major issue is missing deadlines. If you don't act within the required time frame, your appeal may be rejected automatically. Another common problem is insufficient documentation. Without detailed records for your provider, Medicare or your Medicare Advantage plan may deny your appeal again. Lastly, many seniors are unaware of the specific rules for Medicare Advantage plan, and then such as network requirements or prior authorization. An example, John's claim for a cardiac stress test was denied by his Medicare Advantage plan because prior authorization wasn't submitted. By working with his doctor and resubmitting the necessary paperwork, he successfully appealed the decision and had the test that he needed. So let's go on to section 4, how to file an appeal and succeed. Now let's get into the step-by-step process for filing an appeal and improving your chances of success. Review your Medicare summary notice or explanation of benefits to understand why the claim was denied. Gather supporting documentation such as medical records, test results, or a letter of necessity from your doctor. Complete your appropriate appeals form. For original Medicare, use the CMS 227 form. For Medicare Advantage plans, contact your plan for their specific appeal form. Submit your appeal within the required time frame, and remember 120 days for original Medicare, the determination, and then typically 60 days for a Medicare Advantage appeal. So that timeline is very important. You know, guys, one of the easiest ways to timeline things is to just get a sheet of paper and put the start time of when it happened, and then draw a line out and put an ending time, and then along the pathway put the date and time, and then like if you are talking to the healthcare plan, put it above. If you're having to go to Medicare, put it beneath, and keep a timeline. But you're going to take and say, if it's dealing with original Medicare, 120 days. If it's dealing with a Medicare Advantage plan, it's 0 to 60 days. And in that time frame, you need to make sure you stay on top of doing everything you need to. And then also a calendar is a big help. If you guys are like my mom, my wife, I live my life by my calendar, off my phone, off my computer, and everything syncs. But my mom takes a paper calendar and puts it in her kitchen. And guess what? She puts her doctor's appointments on that, and she puts important information on that calendar, and she looks at it every day when she goes in and out of the kitchen, and just make sure that she has a reminder towards important things. That's a great way for you to be able to document and make sure you don't run out of time and don't fall into more complications in this appeal process. So track your appeal status and follow up with Medicare or your plan if you don't receive response within the time or stated time frame, guys. So segment 5, success stories and encouragement. Appealing a denied claim can feel overwhelming, but it's worth the effort. For example, Mary appealed a denied claim for physical therapy, and with additional documentation from her provider, Medicare reversed the decision. Success stories like Mary show that persistence pays off. Remember, you're not alone in the process. Reach out to your doctor, reach out to your agent, ask questions, take notes, and then engage in the process and keep a timeline and make sure you mark your calendar. Like I said, like my mom, she puts it down on the calendar and it's a great reminder. Hey guys, thanks for watching. Don't forget to like, share, and subscribe to our channel. Watch more videos to stay informed about Medicare's benefits and processes. And you can schedule a call with us today and let us make Medicare simple for you.
Thank you.